Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shom. On the program tonight, the tragic loss of 269 doctors in this phase of COVID. Those numbers, well, even if they may be a fraction of the total lives lost, in fact, in this phase, it's a huge number considering how important doctors are in this predicament. Sadly, however, only 3% of these doctors had been fully vaccinated. In fact, only 66% of our doctors and frontline health workers have been fully vaccinated even now, despite being frontline workers. They were being administered doses of the vaccine several months back, but why only at 66%? Why have we reached just that number? On the show tonight, we look at not just the extraordinary courage of our doctors and medical workers, but also at how the lack of complete vaccination has been disastrous for our already overstretched healthcare setup. Also on the show tonight, up to 93 of the over 500 personnel manning oil rigs and barges in the high seas off the Mumbai coast are missing a day after Cyclone Taute swept past the Maharashtra coast. The Indian Navy and Coast Guard have been involved in rescue operations. We'll be joined by a senior Navy officer overseeing these operations on just why these rescue operations have been taking place in exceptionally difficult conditions. But let's quickly go across now to our top discussion. The very sad loss of doctors. As many as 269 have died in just this second phase of COVID in the country. Joining us now, some of the brave doctors who've seen their friends, their relatives, also doctors, pass away tragically and have still decided to come and speak to us. Joining us now, Dr. Nirmala Agarwal. She's a senior gynecologist. She's lost her husband, the well-known orthopedic surgeon, Dr. Shekhar Agarwal. Ma'am, thank you so much for being with us and having the courage to come out and speak at the situation. Dr. Rajan Sharma is the immediate past national president of the Indian Medical Association. Also joining us now, Lieutenant General Dr. Vipin Puri. General Puri joins us from Lucknow. He, in fact, was infected with COVID 2 times, despite getting 2 jabs. And we're also joined by Dr. Sudhanshu Bankata, who lost his colleague and a doctor from Batra Hospital. Let me go across to you first, Dr. Agarwal, and our sincere condolences for your incredible loss. Could you tell us how fighting for COVID patients was something that your husband continued to do right till he contracted COVID himself, and he would have it no other way?
Okay.
Go ahead, ma'am. Did you hear my question?
What was the question?
Ma'am, my question is, how was your husband fighting to save patients on a daily basis right until the time that he contracted COVID?
You know, lockdown started somewhere in mid-March 2020, right? And then the government said, okay, we need to take 40%, and then almost 80% of the hospital, Sant Parmanand hospital, was COVID converted. My husband, Dr. Shekhar Agarwal, was the executive director and vice president of Sant Parmanand Hospital, and also orthopedic surgeon, chief of orthopedic department, and hip and knee surgeon in Parmanand Hospital. He not only was operating every day for orthopedics, he was also administrator. Okay, so he used to go at 7:30 in the morning, COVID or not COVID, and he used to operate in the OT non-COVID patients. But COVID patients were separate, and then he will go downstairs to the basement, the board room, where it was like a war zone, like of a thing, and he had a team of people. He himself was alone sitting on the other end, and he was always wearing 3M mask, and he was also wearing the face shield and everything, protecting himself continuously, even during clinic time. But throughout, he was doing the administration of COVID. COVID first was 40% and finally went on to 80%. By the time my children were getting worried also that, Dad, you are going to get infected. My son Kunal was asking, why don't you just sit at home and do the administration now? You have a team of orthopedic surgeons who will operate for you. Just sit at home, and also all administration can be done on the Zoom to them.
What did he say?
He said, the captain does not leave the ship. He's the last one who will leave. I have to go every day. And I take care of myself. And he kept taking care of himself. But he, in the end, got that COVID somehow or the other.
Yeah.
Okay? And he was tested positive on 21st of April.
Yeah. No, this is just so very sad, ma'am. Ma'am, I just want to go across and I'll come back to you, to Dr. Sharma. Dr. Sharma, in a situation like this, isn't it particularly disappointing when we come to learn that of all the doctors and frontline workers who have lost their lives in the second wave, only 3% were completely vaccinated? Why is that the case?
Good evening, everybody. First of all, my homage and to Dr. Shekhar Agarwal, whom I had interacted as a very young orthopedic surgeon in conferences and have huge respect as a profession. And also my condolences and homage to Dr. K.K. Agarwal, who was perhaps the first one in the country to ring the bell for COVID. And he has educated the entire class of doctors about COVID with his sound knowledge, and we lost him. Now coming to the point of vaccination, yes, when initially vaccination was launched, it was a bit of a hesitation, but then all of us started taking it, and IMA actively promoted that we should get vaccinated. And a lot of in my branch and even in Delhi, a lot of people got vaccinated.
But Dr. Sharma, only 66% of all doctors in this country and frontline workers have received 2 doses of vaccines. Why has vaccine hesitancy among our frontline workers and doctors been there in the first place? These are IMA statistics, sir.
I am coming to that. Sir, you also have to rule out pregnant doctors, lactating doctors, and other people. Yet this young doctor who died in a Gurdwara working, it was such a big procedure to get a sanction for a vaccination.
No, but sir, that still doesn't explain why, just 66% of all healthcare workers, including doctors, have been vaccinated so far. Even if you discount those who are pregnant, those who are lactating mothers, and a few others who cannot perhaps get the injection, right? Why hasn't that number gone up to 100% or as close as possible?
I don't have an answer to that. Frankly telling you, I would say that this is I am vaccinated. My entire family, we are all a family of doctors. We are vaccinated.
Because, sir, the loss, besides the incredible personal loss that someone like Dr. Nirmala Agarwal speaks about, and it's an incredible loss to the system when we lose a doctor and when we lose a healthcare worker, particularly in the war zone that we are now operating. And to learn that so few people, that's only 66% were fully vaccinated is quite problematic. Sir, there's an example I must share. I inquired a few days back about vaccination in the Indian Army. I was told that 99% of the Indian Army is double vaccinated. Why? Because they were given an order. And the 1% which isn't vaccinated, they're either on leave, coming back into service, or deployed in areas where it's not possible to get them out and give them the vaccine.
Absolutely.
But if that same alacrity had been shown by our healthcare workers, then perhaps we wouldn't have lost these precious lives. I mean, that's just my submission. Dr. Bankata, would you agree with that? That vaccine hesitancy is a problem for doctors as well and healthcare workers?
Well, particularly in our hospital, it has not been the case.
Right.
I think 95% of our doctors have been vaccinated. There have been instances where the doctor has not been too comfortable with the science behind the vaccine, so as to say. So in those cases, maybe there have been situations that the doctor has not got himself vaccinated. But by and large, at least in our hospital, we've got almost all of them vaccinated. So I cannot...
Sure, and that's wonderful to hear, Doctor. Could you share with us, your memories or your thoughts of a friend, of a colleague at Batra who actually lost their lives fighting this war?
Yeah. So Dr. Hemtani was the head of gastroenterology. He was a great person and a very, very cheerful and a very jovial kind of a person. He was always there for almost everybody who had to go to him to consult him or to seek any help. He was a gem of a human being, and to see such a fighter, such a spirited person, and to lose him under very terrible circumstances, which was when we ran out of oxygen. So this was probably he might have pulled through had we not run out of oxygen at that minute. But then so it happened, and we are very sorry to lose one of the greatest warriors that we had and one of the most cheerful persons that we had in our hospital.
Yeah. General Puri, you've had COVID on 2 occasions. You've also had 2 jabs.
Here?
Ma'am, just one sec. I just want to go across to General Puri. Sir, is this something that actually worries you? I understand that statistically you are very much in the minority, right? But does it worry you that you've had COVID on 2 occasions and you've also had 2 jabs? That it's not supposed to have been this way.
Firstly, Vishnu, thank you for having me on your show. Well, yes, I think there are a couple of points which require to be elaborated, emphasized, and driven home. First, vaccine, we know, and from the current state of information and knowledge, that vaccines are protective. And I think this point which you brought up of vaccine hesitancy is indeed, I think, a very, very important issue, which continues to plague even the literate many in our country.
Yes.
And as you very rightly brought out, that there is a fair amount of percentage of people, even the frontline healthcare professionals, who did not get immunized, despite the knowledge that we have that how much vaccine is important as far as our protection is concerned. So I think that's very important. Having said that, I took my 2 jabs. I, by virtue of my employment, the place where I work, that is the King George Medical University. You know that we are amongst one of the largest COVID care centers today in Uttar Pradesh, with more than 983 beds as we talk. So me as the head of the institution, it's important for me to be going around my setup, my entire infrastructure, and as is understandable that the viral load in any healthcare infrastructure would be fairly high.
Yeah.
And I think that's the sort of the problem that we go through as healthcare professionals, and that perhaps is the reason why I possibly got the infection. Having said that, I know and I'm aware that it gives us protection, and perhaps that's why both the times I had very mild symptoms, and I came around very, very easily.
Yeah. Dr. Mangata, would you like to perhaps comment on that? That, if you do receive your 2 jabs, statistically in India, and this is very correct, the number of cases of doctor fatalities is minimal, absolutely. And that second jab really does help towards progression to, so we don't want to encourage vaccine hesitancy at all. And the numbers actually say that the vaccines work. Your thoughts?
Absolutely. Absolutely. Because even in our hospital, even if I do not talk about the doctors, even the patients who got vaccinated, they have a better outcome.
Yeah.
So, and especially the doctors, I don't know, like most of us have been trying to save ourselves from the primary exposure itself with the help of masks and hygiene and social distancing. So, but even though like at least 18-20 of our patients, of our doctors, they did catch COVID, but we had only one fatal outcome. So I think, yes, it has made a change, though a much larger study is warranted so as to bring out the various factors around this.
In fact, there are some preliminary studies which have taken place. Dr. Sangeeta Reddy of the Apollo Group actually has tweeted on this today, and she said it's very sad, and she was commenting on the death of a doctor. She said, I'd like to share important data. Out of 3,600 doctors, nurses, and healthcare workers vaccinated with 2 doses at Apollo hospitals in Delhi, only 2.6% got infected with mild COVID and no death. This is such a critical factor. And statistically, it seems to bear that case. I wanted to go back to Dr. Nirmala Agarwal. Ma'am, how important was it to vaccinate in terms of a message which your husband consciously and consistently sent out? Vaccinate, vaccinate, vaccinate.
Dr. Shekhar Agarwal and I got vaccinated Covaxin as per government rule when it was first available on the very first day. When it was available in Sant Parmanand hospital. I don't remember the date, okay? It was one of the very, very first hospital. And a month or so later, we got the second shot also. Okay? And we still didn't feel that we are safe. We completely protected ourselves, completely regimentally we carried on, okay? 1 month or so later, Shekhar got COVID. About 3 days later, I got COVID. Okay. At that time, we tested our antibody level also. Our antibody levels were practically nothing at that time. So I can't blame the vaccine as such. I think our bodies were not developing enough. Maybe 6 months later, we would have developed the antibody. So if doctors and health workers vaccinate, they must vaccinate and protect themselves with mask and hand hygiene and everything, and continue that, save themselves. Maybe by 6 months, or some people get it, maybe in 1 month some people get it, but both of us didn't get it, okay? And I got COVID very, very mild. And even though I had more comorbidities, okay? We are same age. I have hypertension, diabetes, thyroid, and I'm a little fat also if you look at me. All these things I had. And Shekhar Agarwal had none of these comorbidities. He was not diabetic. He was not obese. His body mass index was only 24.
Right.
He's much thinner than me, okay? But what we were worried was that until 2 years ago, he was quite asthmatic. And we were worried that this is going to be troublesome. You know, comorbidity is not there now, but it was there before. And it can actually affect and play bad. We knew it. And I'm telling you, whatever it is, vaccination must be done. Must be done.
And I think that's such an important point. That's such an important point that you make. And, you know, despite your own experience and that of your late husband, the importance of vaccination. I'd like to thank all of my panelists this evening for joining us. It's such a tragedy that we've lost nearly 300 doctors in this country in just the second phase. And these are just doctors. We've lost many other healthcare workers, frontline workers to this scourge that is affecting us. I'd like to move on now to our next big focus this evening. There is a desperate rescue mission which is on in the Arabian Sea off the coast of Mumbai and off the Gujarat coast as well. This is after the cyclone sort of shredded its way past the coast of Maharashtra, hitting Bombay High, and resulted in a barge sinking.